More on borders and the virus. I mean, the way this country has both overreacted to coronavirus infections and then turned in on ourselves with hard borders between the states, I think will be looked back on eventually as a big mistake. Look, I know it's popular now. People think the premiers are keeping the virus at bay. But the virus will be with us for months, a year, perhaps many years. And we simply can't cope as a society, an economy, a country, unless we're prepared to accept a certain manageable level of infections. We don't stop driving because of the road toll or shut down because of the annual loss of life from the flu or close all our beaches because people drown every year. We always, of course, judge the risks. We manage them sensibly and we think about costs and benefits. In time, we're going to have to be smarter about the coronavirus. We've got massive health resources ready to deal with virus infections now, but we continue to shut down parts of the country and block borders to stop anyone getting infected. And this despite just one death in the past month. Just 2 people being in intensive care in this country as we speak, and just over a dozen people even in hospital. We've got about 1 person in hospital in this country for every 2 million people when it comes to the coronavirus. 99% of people who get the virus or are infected with coronavirus have very mild symptoms or don't suffer any symptoms at all. Perspective is what we want, but instead we get this. The Queensland LNP has attacked Labor Premier Annastacia Palaszczuk for closing the borders and keeping them closed, saying naturally enough that it's costing jobs in a state reliant on tourism from the southern states. And so Queensland Labor hit back last night, saying that if it was up to opposition leader Deb Frecklington, that Queensland would be flooded with Victorians. Really? Flooded with Victorians. Ugly, isn't it? So ugly that Labor deleted that from Twitter, although it's still floating around on Facebook. Of course, those Victorians would be bringing money into Queensland to spend and keep Queensland businesses going and create jobs north of the Tweed. But COVID paranoia is running strong. I showed you yesterday how South Australia has declared Victorians persona non grata too. So much for our federation. And now New South Wales has outlined tough penalties, even jail time, for any Victorians from their newly locked down suburbs who dare to travel north of the Murray.
There will be strict penalties for those who travel to New South Wales from those hotspots. Now, I don't expect that to happen because if the Victorian authorities are doing their job, where they're having strong compliance in travelling around those streets and those suburbs, I don't expect anybody to be breaching to be able to actually get out of those hotspots in the first place.
Don't you think it's all too much? Do you think if there is no vaccine, as is highly likely, we'll still be behaving like this in 3 months, 6 months, or a year from now? Of course not. We can't. So why are we creating fear and loathing and crippling our economy now? There's been so much good, clear advice on this stuff, on how to be sensible for so long, but the premiers have been belligerent. Remember, for instance, how on this program we said many times, on the advice of medical experts that we interviewed, that Victoria had closed down its schools unnecessarily and then kept them closed far too long. Well, now that Daniel Andrews has put large parts of Melbourne into strict lockdown again, guess what he hasn't closed? Schools.
The very clear advice from the Chief Health Officer and the Public Health team is that we have not seen significant or even very much at all transmission between kids and adults. On that basis, not a judgment made by politicians, a judgment made by the health experts, schools can remain open in those hotspot postcodes.
Yeah, that's right. But that's always been the case. So he's admitting he was wrong now, is he? In March, April and May. Now, as you know, I cut all our leaders some slack on this. This is all new. And overall, we've done well to give ourselves a chance to shape our destiny, not have the virus push us around the way it has happened in many other countries. But surely this is what we're going to see now. Premiers gradually starting to wake up and listen to the medical advice that's been around all along. and realise they have to accept some level of infections. They should not cause unnecessary economic harm by pretending they can deliver a coronavirus-free world. They just can't deliver that without shutting down society, a classic Pyrrhic victory. As we've been saying here for months, guided by the medical experts, we have to learn to live with infections, slow them and manage them, because eradication is just a bridge too far.